Fire Attack Bravo, Rescue 48, District 48, LR 45, gunshot trauma, 3107 Downing Street, Grid 292A, Rescue 48, District 48, LR 45, Fire Attack Bravo.
We're going to a shooting call. What are some of the considerations we need to start thinking about en route to a shooting call?
Scene safety, additional resources. Where's our closest hospital? What's the weather like? Do we need air support? Those are some of the things that I would think of right off the top of my head. Maybe staging.
Staging, absolutely. One of the things we really want to start thinking about too is if law enforcement is on scene, is the scene truly safe?
Right.
We need to make sure that law enforcement is there, but we also need to make sure that they're saying, yes, we have, the suspect, or we don't know where the suspect is. And if that's the case, make sure that when you're on scene, once you get on scene, that you have an escort, a PD escort that is protecting you while you're getting the patient out of that hot zone.
Right, and also make sure that you are putting on your tactical gear at your staging location prior to the arrival at the scene, because it would be really bad to pull into a hot scene and not have your tactical gear on. And also remember too, just because law enforcement is on scene doesn't necessarily mean the scene is safe.
Correct.
Or stable. That could change in a moment's notice. So
Absolutely.
Keep your head on a swivel and make sure that you're in your tactical gear.
Right, and like you were saying, Dustin, is that when we get on scene or we get to our staging location, that's going to be that opportunity to get that tactical gear on. You don't need to drive with that stuff on.
Right.
Rescue 48, that patient.
All right, this is a good time to point out, make sure that when you bring in your equipment into the scene, that you're staging your equipment at a location where, if you have to make a rapid egress from the house, that you're not going to have that equipment in front of you. You can see that they brought in there all the essential equipment that they would need for this call. They have their ballistics gear on. The only thing they would want to do is probably not put their bag in a egress position to where they're going to trip on it if they have to run out of there.
Ma'am, what's going on? What happened?
My boyfriend shot me.
Where'd he shoot you?
In the chest.
Alright, I'm gonna cut her shirt off real quick. Looks like
She's got a weak radial, she's pretty tacky.
Okay. Looks like her airway's patent, she's breathing. Alright, ma'am, I'm just cutting your shirt off, okay? Because we need to check where you got shot, alright?
Okay.
Alright, so yeah, I got a gunshot trauma to the chest. I'm gonna go ahead and call a trauma alert. Rescue 48 dispatch, this is gonna be a trauma alert. Alright,
Okay, you can see how they're working really well together. As each one of them finds something, they're letting their partner know what they've found. They've covered their airway, they've covered their breathing, they've covered their circulation, they've covered disabilities by figuring out, hey, what's her level of consciousness, and they've exposed her and found a gunshot wound to her left chest. Now they're communicating that this is a trauma alert patient, and now what they're going to end up doing is they're going to end up starting to do their initial treatment. But remember, the policy states we want to be off the scene within 10 minutes of notification of trauma alert status.
Right, and I think another thing to think about too, this is another point where we could think about our transport. How are we actually going to be getting off of this scene to the facility that we want to go to? What's the appropriate facility?
Her lungs sound good.
I'm gonna go ahead and get the chest seal on. You want to check for an exit wound real quick?
Or just a little bit. She does not have an exit wound.
Okay, no exit wound.
Nope.
All right, man, we're just gonna put this on your chest, okay, to make sure we cover this wound, all right?
Okay.
Are you having any difficulty breathing?
No.
Okay.
Hey, any of this hurt? No. Can you take a deep breath? Tell me if anything hurts you while I'm touching you.
Caitlin, I'm gonna go ahead and throw on some oxygen. You okay with that?
Yep. Anything down here? No. Anything on this side? You feel all this? Yes. Can you wiggle your toes? Can you pull up? Everything feel okay down here? Yes. What about up here? Any of this hurt? No. Any of this hurt? Yes.
All right, man, I'm gonna put you on a little bit of oxygen, okay?
Can you squeeze my fingers?
A little tickle, okay?
Can you feel where I'm touching you? Yes. Can you feel where I'm touching you over here? Yes. Okay.
All right, I'm gonna ask you a few questions, okay? Do you take any medicine for anything?
No.
Any allergies to medications?
No.
Okay. So no past medical history, nothing like that?
No.
All right. What's the last time you ate something? Did you have something to eat recently?
No.
No? Okay. All right, how bad's the pain? 0, no pain, and 10, the worst you ever had in your life?
10.
Okay. All right, man, so we're gonna pick you up and we're gonna get you on the stretcher, okay?
Okay.
Do me a favor, lean forward. All right, go ahead and hand me your arms. Good. All right, on 3. 1, 2, 3.
Step behind you. And step in front of you.
All right, go ahead and lean back for me.
We're in the ambulance, we're transporting the patient. Now is when we're going to start getting all of our ALS interventions in place.
Right. Is it okay if your transport's not on scene yet to go ahead and start some of those ALS interventions?
Yeah, absolutely. I mean, you want to get as much done as you can before your transport unit gets there, but obviously we don't want to withhold interventions waiting on transport. So yeah, if you can do an IV before the ambulance gets there, go ahead and get that IV started. Especially if you start talking about critical things like critical airways, hemorrhaging that needs to be controlled, or anything that's important that needs to be taken care of. We need to do that. And that brings up a really good point. Those things that we are going to do on scene prior to transport. If you have a compromised airway, we need to actually fix the problems as we find them. That's one of the big things in trauma is let's fix it as we find it and move on. Obviously, when it comes to IVs and raising a blood pressure by 10 points or something like that systolically, that's stuff that can wait as long as we got the patient in the right position. And if they got them laying flat, if they're going to have them in let's laying flat on the backboard or however it's going to be. But we want to find it, we want to fix it, and then we want to move right along.